Yo, plant-based buddies, one of my friends just sent me a heartfelt message. She just got diagnosed with a fatty liver, probably diagnosed with blood testing that showed inflammation or increased liver enzymes. So now I took a few notes to make sure that we go through everything in detail without missing anything. So commonly, fatty liver is diagnosed through simple blood tests, usually an incidental finding. People get routine blood testing done. Your doctor checks your liver enzymes and says, ooh, they're increased. Sometimes he'll confirm on a second blood test, and if it's confirmed, he'll often order an ultrasound of your abdomen. Now, if you're getting an ultrasound of your abdomen for other reasons, they still can see and diagnose a fatty liver, also called steatosis or non-alcoholic fatty liver disease, NAFLD. Way back when, the most common cause of liver transplants were cirrhosis due to alcohol, and now actually, with the advent of modern medicine and modern diets, the most common cause of liver transplantation, liver cancer, and cirrhosis is actually fatty liver or steatosis or non-alcoholic liver fatty disease. Now, keep in mind that most people don't even know they have it. Genetically and for other reasons, diet included, people will store fat in their liver instead of storing it in their thighs or in their butt or in their abdomen. When you store liver inside your organs, it creates inflammation. It increases the risk for insulin resistance, type 2 diabetes, what we call metabolic syndrome. It increases your blood cholesterol, blood pressure, and it puts you at higher risk for not just liver disease, but also for cardiovascular disease, which is the first killer of Canadians and Americans, okay? So steatosis, fatty liver, or non-alcoholic liver fatty disease is nothing to laugh about. It is very serious, and it'll kill you slowly. It'll take maybe a decade or two before you start having issues with it, which is why people don't take it seriously. Now, the most important thing that someone can do to alleviate that is lose weight. Even a small reduction in your body weight, even losing 5% of your body weight, the good part is losing the weight means that, well, even if you just lose 5% of your body weight, that 5% is likely going to be lost from the liver first. You'll get rid of that fat first. So even if it's the most dangerous one, it is the easiest one to lose. But you have to lose it, right? And some people, if you're looking at averages, gain a few pounds every single year and will never stop gaining until they meet their first chronic disease. Obviously, if you leave it untreated, it can lead to liver scarring, liver fibrosis, liver inflammation, and then cirrhosis is where there's irreversible scarring, and that's a risk factor for liver cancer and liver transplants. And like I say, we're seeing more issues from fatty liver due to diet and obesity than we are seeing it secondary to alcohol nowadays. I'm looking at my notes. So obviously you want to stop the contributing medication. Certain medication can contribute to high fat levels in your liver. Alcohol is not a medication, but a product that you can consume. So you have to stop drinking when you have a fatty liver. You have to stop medications that could be suspected to cause it, like steroids. You weigh the pros and cons with your doctor. And first thing you want to do is, other than losing weight, is changing your diet. Even without associated weight loss, simply switching the intakes of saturated fat with poly and mono unsaturated fats, so bad fats for good fats, will reduce the amount of fatty acids that are stored in your liver and oxidize to create inflammation. So that means saturated fats, where do you find them? Cheese, dairy, eggs, and meat. So in a nutshell, animal products. Where do you find good fats? Soy, tofu, tempeh, edamame, soy milk, nuts, seeds, legumes, every plant. Pretty simple answer, how to switch your saturated fats for polyunsaturated fats. If you're using oils, they are rich in good fats, but it has to be within a calorie controlled diet. Oil is highly calorie dense, meaning it's easy to overshoot your calories if you're including it in your diet regularly. Increasing exercise, simply exercising moderately, 20 minutes, walk 3-4 times a day is significant and very helpful to displace that fat from your liver, even if it's not associated with weight loss. And obviously the most important culprit in your diet is usually high fructose containing foods. And I'm not talking about the fructose found in fruit. I'm talking about the fructose that you find in ultra processed foods that is not surrounded by fiber. So high fructose corn syrup that you'll find in pop or sodas, or that sweetens most of our ultra processed cereals. You'll find that in chocolate bars, and pretty much all ultra processed foods, they use high fructose corn syrup. So if you can avoid that, that'll definitely help you out in the long run. A lot of cases of vitamin D deficiency are associated with that, so consider getting your vitamin D levels checked and or taking a supplement of 1,000 to 2,000 vitamin D units per day. Now, also consider omega-3 supplements. These are unsaturated fats, they're healthy fats. Studies have shown that taking up to 4 grams, 4,000 milligrams, or 4 grams per day of omega-3 can reduce liver inflammation and liver enzymes. Probiotics, if your fatty liver is associated with dysbiosis, which is an unbalanced gut microbiome, you can maybe kickstart the process by taking probiotics for a few months. But in the perfect world, you would actually use prebiotic or soluble fiber, which you can find in oats and chia seeds and plant foods. And you would use a variety of different plants, berries, nuts and seeds, get that soluble fiber in. You should also consider getting vaccinated for Hep A, Hep B, and for pneumococcal pneumonia, which are all recommended with anyone that has a chronic liver condition. And steatosis, fatty liver, or non-alcoholic fatty liver disease are all chronic liver conditions. People put off taking care of their liver because they won't feel symptomatic. That's an issue we see at the clinic. I have a ton of patients. I know that this is gonna sound an alarm bell for a lot of my patients, because I know for a fact that I think I have 5 or 6 patients that are gonna be watching this video and that have been diagnosed with fatty liver. Now, people get motivated at the beginning, they do their blood test 3 to 6 months, they feel fine, their blood test stays stable, sometimes they go up or down and they fluctuate. People don't panic, they get their blood test again next year, nothing has changed, so they don't move on it. The inflammation in your liver, when it stays there for a long time, ends up getting to fibrosis, which is scarring, and then as the fibrosis builds, it is irreversible. And after a decade or two, you get the beginning stages of cirrhosis. I have a 45-year-old patient with cirrhosis right now, and I have a 58-year-old patient with cirrhosis. Once you have scarring in your liver, everything else goes to sha-la-la. You know what I mean? It doesn't go well, okay? But the thing is with fatty liver is you have time. Time is on your side. You have a decade to make changes and to lose weight. And once you lose weight, the first pounds that are going to come off, the first fat that you're going to shed is the fat that you're storing in your liver. So simply aim for a calorie deficit, aim for a diet with healthy unsaturated fats instead of saturated fats, aim for a lot of omega-3s, even supplements, vitamin D supplements, and avoid foods that are high in high fructose corn syrup, which is basically just says avoid ultra processed foods, avoid sugary beverages, focus on whole plant foods. So I could have just said the solution is be active and eat a plant predominant, minimally processed, whole food, plant-based diet. That would have been simpler, but not as sexy. So hopefully this has helped. Let me know in the comments if ever you've been diagnosed with a condition called fatty liver, liver inflammation, increased liver enzymes, non-alcoholic fatty liver disease, or steatosis, because they're all the same. Right on. Hope this helped. I hope this helped that specific person that sent me a message she was highly alarmed. I do not blame her. Her liver, your liver is your main detox. Your liver does everything. It has a high capacity for regenerating itself if you treat it in time. But time is on your side. You have 5, 10, 15 years before you start having permanent scarring. But most people that have cirrhosis or steatosis don't even know it. They don't feel it, so they don't act on it. And time flies by fast. And then they're in a situation where it's irreversible. Right on. Love you, my friend. I hope you all the best. And I hope that this has helped you and will help the others that'll listen to this video. Cool.